Welcome everyone and welcome to this evening's health show. My name is Dr Sulthana Ahmed. I am a GP and I am live from British Muslim Studios here in Wakefield. It's nice to be back after I had a short break during the end of Ramadan and for Eid. I hope everybody had a wonderful month. So we are back to discuss a very important topic indeed, and that is the one of breast cancer. Now, many women may be quite shy or embarrassed to bring up this topic, and many men may think that it's completely irrelevant to them. And we are here to educate you more on this topic. Now, 1 in 8 women develop breast cancer in their lifetime, and what the research so far tells us is that earlier detection can lead to a better recovery and better outcomes for the patient. So to discuss this topic with me further, I have a specialist, a Dr. Virginia Wolstenholme from down south London. Good evening. Thank you so much for joining us today. How are you doing?
Very well. Thanks for inviting me and good evening to everyone.
Are you able to tell us, because you are a breast cancer specialist, are you able to tell us a little bit about what you do and what your job involves daily?
Yes, certainly. So I'm a clinical oncologist and I work in London at the London Clinic and also St Bartholomew's Hospital in London. And I specialise in breast cancer treatments, particularly radiotherapy and chemotherapy, but also seeing patients very early on in their diagnosis when the breast cancer has just been diagnosed.
Okay, thank you so much for that. So with breast cancer, many people are aware of kind of cancer and their breasts, and many people may not really know what type of signs or symptoms to look out for. So for our viewers at home today, are you able to explain to us exactly what is breast cancer and how does it start?
Certainly. So breast cancer starts with some cells that start to divide abnormally and grow in the breast out of control. And then they can form a lump, which may be something that is detected by one of the patients, but also can be picked up very early with special scans called mammograms. Some people notice that they might have a lump in the breast or maybe in the armpit or near the collarbone, or other changes as well that you might see in the breast, particularly changes around the skin, some skin thickening, even redness or flakiness around the nipple. And all of these signs are early signs that really alert us to need to investigate more carefully.
Okay, so you mentioned a couple of symptoms there already. So a painless lump that they may detect either in their breast or under their arms, some skin changes. Are there any other symptoms that patients should maybe look out for every month?
Yes, there are other changes as well that we can see, which are kind of warning signs, and that would be if the nipple starts to point inwards or is indrawn. Lots of women are born with nipples that might be, as we call, inverted, and that's fine. But if you notice that there's a change and that the nipple starts to be drawn inwards, that's another sign that we need to look out for and would alert us to investigate women more carefully.
And so for patients who are a bit more curious or want to know a bit more information, is there just one type of breast cancer or is there more than one type?
There are actually many types of breast cancer, and the main ones that we see are perhaps the more common ones, and they're also detected, and the different types of breast cancer are analysed in the laboratory once the breast cancer has been biopsied. So it's very important for us to find out what type of breast cancer a lady may have, because that really defines the type of treatment that she may need after her surgery or even before surgery. So we do take that into account very carefully. We're looking at laboratory changes that might be in the cells themselves so that we can actually define the treatment, so we can treat the patients in a targeted way.
Okay, so even though there are these different types of breast cancers, for the person involved, the symptoms that you described earlier are the main types of things that they should look out for, and they should cover most of the different types?
Yes, the presentation or the way that the cancer starts can be the same regardless of the type of breast cancer that we see. So those signs that I mentioned earlier, mainly the lump, the skin changes, indrawing of the nipple, those kinds of things, they would be the warning signs to alert us, and they can be the same regardless of the type of breast cancer that you have.
Okay. Now, in order to facilitate kind of early presentation to the GP, many viewers may have seen campaigns or TV adverts where they are advised to self-examine their breasts every month. Part of this is so that they can become familiar with their own breasts. They know what's normal for them, what's not normal for them. And so through this kind of regular checking, if they notice any changes, then they can present to the to their GP. Do you have any advice on how they should carry this self-examination out themselves every month? Are there any tips?
Yes. There are lots of leaflets, information online, which really give you lots of tips about what to do. But the main thing is to be breast aware and know what your breasts normally feel like. Try to examine them at the same time each month. Because throughout the menstrual cycle, there can be changes in the breast, which are completely normal, but may alarm people. Yeah. And if you are concerned about anything that you find, my advice would be to see your GP as soon as possible. But really to examine yourself once a month, around about the same time each month, and be on the lookout for any lumps that you might feel or any changes that differ between each side.
Okay. Now, there is a national screening program to try and detect breast cancer, and that involves the mammograms. Now, I've spoken to many patients, and sometimes if they say, well, you know, I feel fine, doctor, I don't have any lumps, I feel well in myself, I'm healthy, I don't have any of the kind of risks that you might expect someone with breast cancer to have. Is it really worth me going to these mammogram appointments? What would your response be to that?
Well, I would really encourage people to come forward if they have an invitation to have a mammogram to do so. The reason being is that when we do the mammograms, we can pick up changes in the breast tissue that are very, very subtle, that may not even be noticeable by the patient themselves. And by looking at these changes that we see on the mammogram, we can help to diagnose breast cancer much, much earlier. And if we are able to diagnose breast cancer earlier, it means that we have a higher chance of curing the patient completely from the breast cancer. So I would encourage them to come forward. They will get invitations for the national screening program. The mammograms are free, they're painless. And you will get your results within a couple of weeks. And it's really important that people take them very seriously and attend those appointments.
Now, are there any risks to the mammogram? You know, is there any kind of chance of picking up something that's not there or causing unnecessary stress to the patient?
Well, the mammograms themselves are given with a very, very low dose of radiation, so that is safe. They can pick up very subtle abnormalities, as I've said. So sometimes we may investigate those abnormalities, which may require a biopsy. And it may be that after the biopsy, we're able to say, well, actually, that's completely normal. It's a benign test, which means non-cancerous, and we can reassure the patients. But having said that, even when you have a biopsy, there is a period of anxiety after you've had the biopsy. You have to wait a period of time to get the results. And of course, that's going to be a very difficult time for people when they're waiting to see whether or not it's going to come back as a cancerous lump or whether they're going to be reassured and told it's all fine. But I think even though that's a difficult time, it's a stressful time when you don't have the results, I would try to encourage people still to come forward because the tests that are done are relatively painless. There is a bit of discomfort with when a biopsy might be done, for example, but it's really important for us to do those tests to diagnose people very early.
Okay, So one of the other questions that I got from one of the viewers earlier on today was regarding risk factors for breast cancer. So I'm sure you will be aware, many years ago, there were lots of things in the newspaper about HRT and breast cancer, as well as kind of the genetic element of breast cancer. Are you able to tell us the types of risk factors or the type of individual who might be at increased risk of breast cancer and so kind of pay special attention to our advice?
Yeah, certainly. So we still don't have all the answers about why breast cancer happens, but we certainly know that there are, it's a disease that occurs in older women. So 80% of cases are in women that are over the age of 50. But having said that, we still see women that are much younger than that developing breast cancer. We know that it's important to keep your weight under control. We know that overweight women can be more likely to have breast cancer. We know there are certain dietary effects that need to be monitored so that we can reduce the amount of breast cancer, and also limiting or reducing alcohol. So those are the important dietary factors. There are also, as you said, some genetic causes for breast cancer, and it's important to remember that these are actually quite rare considering the number of breast cancer cases that we see. And it may be that those patients have got a family history of breast cancer, so that we see a certain pattern of breast cancers or a lot of breast cancer that occurs in one family at an early age. And those patients are then tested to see if they have any particular genetic cause for a breast cancer occurring in their families.
Thank you so much for that, Dr. Wolstenholme. That was really useful. So we are going to go to break very shortly. I will just summarise what we've discussed so far. So we have talked about how breast cancer is the second leading cause of cancer-related deaths in the UK. 1 in 8 women will be diagnosed with breast cancer in their lifetime. We do encourage self-examination once a month, where you can try and detect the early signs and symptoms of breast cancer and present to your GP. They will examine your breasts and perhaps refer you to a breast team if appropriate, where they can carry out the necessary tests. Now, Dr. Wolstenholme is a specialist. She will be here with us for the second half, where we will be discussing the investigations and treatments of breast cancer. So please do join us after this break, and I will see you soon. Welcome back to The Health Show. I'm Sulthana Ahmed, and I am joined by Dr. Virginia Wolstenholme from down south. She is a clinical oncologist, specialist in breast cancer, here to answer your questions today. Do message on the phone number at the bottom of the screen, or by all means do call in by the landline number. We already have some questions that have been sent in, so I will just carry on through them if that's okay with you. So in the first half, we talked about signs, symptoms, the importance of early detection of breast cancer, what the patient can do to kind of be familiar with their breasts, report to the GP at the earlier stages in order to help improve their recovery and outcome. So once they, let's say a patient finds a lump, they go to their GP who then examines them, and they say, yes, there is a lump there, and they are referred to the breast clinic. What should the patient expect once they are there?
So your GP will refer you to the local breast clinic, and it's likely you'll be invited to attend for a series of tests and examinations that will probably last most of the morning or afternoon. What will happen is that you will see one of the nurses or doctors. They will examine you, and usually what happens is at the same appointment you will have a scan of the breast with an ultrasound scan, similar to the sort of scan that you use when you're monitoring a baby. And that scan is again a painless scan that is used to look at the breast and also the armpit. You will also have what's called a mammogram, and that is an X-ray of the breast, which is another way that we can test and look at the breast tissue for any abnormality. Sometimes you may need extra tests done on the same day, and that might be a test where we actually take a sample from the breast tissue so that we can analyze it under the microscope. And that might be what we call a fine needle aspiration or a biopsy of the breast. And those are usually done at the same time in the mornings or the afternoon so that we can gather all the information that we need and then decide what the best treatment is or what the plan is after that. So most of these centres have a what we call a one-stop clinic. So everything is done in one sitting. So it's a fast way of getting a diagnosis very quickly.
Now, many of my patients who have been reviewed at the breast clinics usually come back with quite positive reviews. They feel it's quite fast, it's effective. They usually feel like a comprehensive assessment has been done and they're quite happy and confident with the service. Some of the questions that patients usually return with myself to is, oh, they only scanned one part of the breast or just where the lump was, and they might not necessarily scan both the breasts or both the armpits. Are you able to shed a little bit of light on that?
Well, I think the mammograms will do the job of looking at the whole breast. So that's usually done for both sides. And then we can compare the side that's abnormal to the normal side. So that will give us a really good way of looking at the whole of the breast. The ultrasound scans are usually targeting into the area where the abnormality is, and that's to look at the specific size and the type of abnormality that we can see really well on ultrasound. So it may be that is the way that we're looking at to get the exact size and the measurements of the mass of the lump, and also the same for in the armpit as well. So we can really have a very good look at the ultrasound. So it's by combining both of those tests that we get the maximum information.
Okay. And so let's say a patient has been diagnosed with breast cancer. What type of treatment options are they looking at?
So when you are diagnosed with breast cancer, it's obviously a really difficult time for coming to terms with you've just been told. You will be encouraged to bring somebody along with you to help with the decision making. And before you actually are seen, your case and your type of cancer will have been discussed with a multidisciplinary team of medical professionals. So at that point, we will make a decision about what is the best way to treat the breast cancer. And it's most likely that surgery will be an option and be offered to you to start with. And that way the cancer can be removed completely. And we can also test the lymph glands as well to check that they are free of cancer. So that's most likely what will happen with you, that you would have surgery first. But there are other treatments that sometimes happen before surgery, for example, chemotherapy, if we need to try and make the lump a bit smaller to facilitate surgery in the future.
Now, Dr. Wolstenholme, I'm sure you understand, and you probably have seen this every day in your clinic. Breasts for many men and women have, they're not just an anatomical part of our body, they have cultural, sexual, lots of significances attached to them. And the thought of having surgery or part of, or all of your breast removed can be quite a traumatizing thought for someone. Do you have any advice or further information on that aspect of things?
Yes, I agree with you. I think these are very difficult decisions that have to be made, and certainly we would only recommend having a mastectomy, removing the whole breast, if that is entirely necessary. So we try, if at all possible, to avoid that and do what we would call breast conservation surgery, so like a lumpectomy, if you like. But for some women, if the area of breast cancer is very large, we cannot do anything other than remove the whole breast. And certainly when we do that, we make absolutely sure that is the only option. Remember, though, that even if you do have a mastectomy, which is removing the whole breast, We also offer reconstruction, so adding, if you like, either an implant or taking parts of your own body that can be used to reconstruct where the breast originally was. So all those discussions will be had with you. And remember that most of these decisions don't have to be made immediately. There is usually a period of time where you can safely discuss with your family, your friends, your GP, and also gather all the information and research that you want to have before you make your decision. So you will be very well supported by your medical team, but also other people around you that can help, make people that might have already been through exactly the same thing as you, that can help support you. So they are difficult decisions, and we would only recommend removing the whole breast if it is absolutely necessary.
Yeah, so thank you for that. So I wanted to make it clear that sometimes, yes, mastectomy, which is removing the full breast, is an option, but doctors and surgeons don't take that decision lightly. They will only recommend that if it's suitable for the type of cancer that you have. There is also a lot of support available. So many of the cancer clinics also have attached with them kind of supporting nursing and Macmillan services where you can discuss your treatment options. I'm assuming that's attached with the breast clinics as well?
That's right, and in fact, every patient that has to make a decision about the type of surgery will have their breast care nurse with them as well. So every woman is allocated a specialist nurse to support them through the whole of their breast cancer journey, if you like. And so they will be there on hand at the consultations to answer any questions afterwards. And certainly lots of hospitals will have on site Macmillan centres or Maggie Centre, which again have all the psychological support, the extra support that you might need financially as well, if you're going to have to take a lot of time off work, to give you advice about that, to really try and make the whole experience as good as it possibly can be.
Yeah, so that support, medical as well as kind of psychological, is definitely there. Now, just to kind of end the show, roughly how long will the treatment take from the point of diagnosis to completion?
So if it depends again on what type of breast cancer you have, but you may need to have surgery. You may have chemotherapy afterwards, and then followed that by radiotherapy. So we're talking several months in total. They're not obviously months where you need to stay in hospital or you have to be off work completely, but the chemotherapy may take 4 to 6 months to deliver, and then the radiotherapy can be done in a shorter period of time, maybe 3 weeks, but certainly in the pandemic we've been reducing the duration of the radiotherapy treatment as well to try and give that safely. But you would be talking about several months of treatment from start to finish.
And I know this can be quite difficult and there's no kind of one answer for everything, but just for people to get an idea, what's the kind of rough time frame in terms of survival or recovery for breast cancer that has presented early versus breast cancer that has presented late?
So there are very different types of disease process. So the early breast cancers that we can effectively cure with surgery, patients may need radiotherapy afterwards, and they may well be cancers that will be completely cured and we will never see return. On the other side, on the other end of the spectrum, people that might present very late and at that stage have already had disease that might have spread to other organs, their survival is very much different. And it depends on the type of breast cancer that they have and the treatments that we have available. But having said that, it doesn't mean that it's an immediate death sentence by any way at all. Certainly now we have excellent treatments for even the advanced breast cancers, treatments that are very effective and can really maintain people's quality of life for many, many years.
Thank you so much. And then just finally, if someone is interested in further information, do you recommend any particular websites or places where they can go?
Yeah, I would look at the Macmillan websites. I would look at Breast Cancer Now, and there are other ones as well. But those two are very good. They're kept up to date, and they have very good advice and signposting for people that might need have further queries.
Brilliant. Thank you so much, Dr. Wolstenholme. That is all we have time for today. You have a good evening.
Thank you, and yourself.
Take care. Bye. Right, that concludes the show for today. Please join us next week as we discuss more important health issues. Good evening and Assalamu alaikum.